I have the opportunity to meet one guy who is 19 years old, but he came here when he was 14. And I feel very upset hearing his story. I asked myself, what you doing here? You can go back to Mexico and, enjoy your life. And then he said, no, I have to come to United States because I have to help my family. My father died and I was the oldest one, and I have to help my mother and my brothers and sisters. And I'm so glad Open Door Clinic exists to help with that kind of problem.
Communities in Addison County do better as a whole if we're taking care of those less fortunate. The migrant population in particular, is out there milking our cows and running the farms that otherwise might not be here in Vermont anymore. So they are integral to not only our landscape and the way Vermont looks, but to the economy as well. Well, we see a wide variety of patients for illnesses like hypertension and diabetes that need ongoing chronic care. But I think there is a big need in the community that we're not meeting yet, and those are people who don't know we're here and don't know that we offer free medical care. We need to reach out to them more.
Migrant farm worker patients have a lot of barriers to health. Culturally, it's a different experience accessing health care here. So we see a lot of health issues related to the work that these patients do, a lot of musculoskeletal repetitive injuries, shoulders, knees, backs. We also are seeing an increasing amount of patients presenting with mental health issues, so depression and anxiety related to the stress of living in a different culture and being away from family.
The other half of our patient population are also Addison County residents who may not work on farms, but there are friends and coworkers and neighbors who have not been able to afford health insurance and get the care that they need.
As a navigator at the Open Door Clinic, I actually see a unique group of individuals. A lot of them are coming in because they need immediate health assistance. They'll come into the clinic for free care, they'll be seen by our doctors, and then before they leave, I'll meet with them to discuss their health insurance. If they want to enroll in a plan, how much it will cost, so that they're able to go and see their doctor and get all of their prescriptions taken care of. And this has been life-saving for a number of our clients that we've seen here.
One of the things that makes the clinic a very unique and special place is that there's no judgment. People can come in, be seen for whatever problem they might have, and there's no judgment about the situation that they live in, there's no judgment about where they come from or how they're living their lives, and we're just here to provide free health care.
Providing care here doesn't feel that different from providing care to someone who has health insurance, because when you're sick, you don't feel good, and you just want somebody to help you feel better, and that's what we're all doing.
The Open Door Clinic's challenges are to remain fiscally solid, and it's always hard to run a business when you're asking for donations.
We have about 140 volunteers, and it takes people to coordinate all that. That's what the staff does. So I think my long-term wish would be that we would have adequate funding that was guaranteed so that we can continue doing what we're doing.
I think helping any kind of people is very important. It's part of being a human being, to help other people. It's very important to let everybody know Open Door Clinic exists and you can find help there.